everyone, it's Lisa with livingwithasthma.net, and we're back with another of our Asthma House Calls, where we get to sit down and talk to some of the very best doctors and other health professionals who treat asthma. Today we're here with Dr. Sharlene Llanes of the Florida Center for Allergy and Asthma Care. Dr. Llanes is board certified in both Pediatrics and Allergy and Immunology. She's a member of the American Academy of Allergy, Asthma, and Immunology, the Florida Allergy and Asthma and Immunology Society, and the American College of Allergy, Asthma, and Immunology. Thanks for being with us, Dr. Llanes.
Well, thank you. It's a pleasure.
Now, just to start, for those parents who haven't taken their child to an allergist for their asthma, can you tell us a little bit about what you do and how you fit into a child's asthma treatment plan?
Sure. Well, for starters, an allergy doctor is a doctor, either a pediatrician or an internal medicine doctor, who has advanced training in the field of allergic diseases such as asthma and allergic rhinitis and in people with recurrent infections. And we help provide accurate or help patients arrive at an accurate diagnosis of their condition. We're also here to provide effective treatment plans. And then we're also known to provide educational information to allow patients to manage their diseases, with all the information that they have.
Now, for those parents who are thinking of taking their child to an allergist, perhaps they suspect the child has asthma, or they've been seeing a pediatrician who recommends seeing an allergist, what are some things that they can do to get the most out of their visit?
Well, that's actually a good question. I would advise the parents to make sure they have all their child's medical records, if they've gone to the emergency room, any admissions to the hospital, if they have any medications that they're taking or were taking in the past, any illnesses, diagnosis, infections that were given by their other doctors. And of course, provide us with a good family history. And, when parents go to the office, we expect them to ask us the questions so that they don't go home empty-handed and more confused.
Are there questions that you would suggest a parent start thinking about before going to see you?
Well, they can, I'm sure they have their own questions before they go to us. Otherwise, they won't be motivated to go to the allergist. But I encourage them to ask their questions while they're at the office and maybe make notes. And make notes of what questions they want to ask us.